Hello, everyone, and welcome. My name is Altimare. I'm super excited to be here and present this amazing discussion around our Conversations That Matter series. I'm joined by three exceptionally amazing women and mothers. So I'll let them introduce themselves and then we'll get started with our conversation. Let's start with you, Maya.
Right. Thank you, Joy. I'm so happy to be here, and it's a pleasure to be in company with all of you. I am Maya Hardigan. I'm the founder and CEO of May. I am a proud mama to three little girls in Brooklyn, New York. Professionally, I think a couple of things brought me here to this position and here to this session today. I've been working in healthcare for a very long time, had a little bit of a change in focus at the point that I was both turning 40 and I think having a lot of thoughts about what was going on in the world in the summer of 2020. And I was really wanting to pivot some of my professional career to focus a little bit more on things that filled me up and things that filled my heart, right? And so I founded May just over a year ago as a destination for improved support for Black mothers. And I have been very, very lucky to have a number of phenomenal other women in the fold and involved with May. Some of whom are on the call today. I will kick it over to you, Dr. Owens, for a quick introduction.
Hi, everyone. I am Michelle Owens. I'm the clinical director for May. I am a maternal fetal medicine subspecialist, so I deal with high-risk obstetrics. I am also a mother of three. I have an 11-year-old and two very spirited 8-year-olds. And so I kind of have fallen into this space for a variety of reasons, not only because dealing with pregnancy and the birthing experience is my job, but I also have been very passionate for a long time about underrepresented communities and also those people who are socioeconomically disadvantaged, so kind of marginalized groups as they interface with the healthcare system. Additionally, as a mother of three and having gone through my own birthing process and experienced some complications, I'm a near miss and could have very easily ended up on a maternal mortality review. And I work in the MMRC here in the state of Mississippi, which is where I live and I work. And as I've reviewed that and then also kind of viewing those things through the lens of my own personal experience, it's just really, I think, made this even more personal for me. And I have just decided that I wanted to do everything I possibly could to, number one, improve the birthing experience for women like myself and for those who have typically been marginalized. But also, this is, I feel like my life was spared for a reason. Mm-hmm. And the best way to utilize that is to do whatever I can to help decrease maternal mortality in this country. And so that's really why I'm here.
Awesome. Jacqueline, great to see you. Why don't you tell us a little bit about who you are and what led you to this amazing work as well?
Absolutely. My name is Jacqueline Clemens. I am a birth and postpartum doula. I'm an author and perinatal health tech CEO. I began this work about 20 years ago with a friend, being very passionate about community care and making sure that those around me that look like me were taken care of. It was a very organic entrance into this work. And over the years, it has really developed into something beautiful for me, learning about traditional postpartum, traditional birth practices, plugging into communities around the nation and learning what makes us unique and diverse as Black women. I was privileged to have a Black OB for my first two pregnancies and a Black midwife for my last pregnancy. And I am forever grateful for the impact on that. And so I am a loud voice in advocacy for Black women supporting and serving other Black women, because like Dr. Owens said just a moment ago, it can go left really quick. And any of us at any given moment, no matter what our background is, could easily be a statistic. So standing up for one another, supporting one another, and speaking about the hard things so that we can, you know, have a base to start from is what I'm here for.
That's great. That's excellent. I love that. I think, you know, we all have come to this place and we come to this moment from different places. Just a little bit about myself. Again, I'm Joy Altimare. I'm the Chief Revenue Officer at EHE Health. I think it says I'm an executive and advocate, but just like Jacqueline, I think I live a little bit what Dr. Owens said too. I feel like I'm here for a reason. And I think what I always say that I will have failed in my work if my daughter is fighting the same fight when she's pregnant, when she's delivering. So my goal is, even though I'm the Chief Revenue Officer for a healthcare company that talks about preventive health, my focus, my passion, my goal is to make the world better for all of our daughters and for our sons too, when they have children, so they can be educated around and support their wives as they give birth. So lucky to be here with you guys. We're gonna have a 30 or 45-minute conversation around the importance of this topic of Black women. And as you said, Dr. Owens, maternal mortality is something that's happening. It could go left or right, and we wanna talk about what leads to that, but also some things that we can do to prevent it. So we've all just talked about our different pregnancy experiences. I had a daughter at 38. I had a very different experience in the sense that I felt healthy, but clearly there were things that were going on at 38 that I was not aware of. So we know that the numbers, we all know the numbers. It's clear that Black women are suffering from preventable illnesses and death during pregnancy at a rate much higher than other women. We all know that we can quote the statistics. Dr. Owens, help us understand what are the key factors that lead to this increasing number of Black women either having illnesses that could be prevented or dying during pregnancy and birth?
I think that's a really important question. And when you familiarize yourself with the fact that Black women are 3 to 4 times more likely to die during childbirth or during their birthing experience, then it begs the question, what exactly is going on? And I think historically, we've not really delved deep enough into that question. I think people would say, oh, well, it's socioeconomic status or it's education. But when you look at the numbers, that actually doesn't necessarily hold true. There are women who are of higher socioeconomic status and who are also very well educated. And those women still disproportionately suffer adverse outcomes when compared to their white counterparts. And so I think with all of the attention that's been turned to this, we really had to ask even harder questions. Like, are we okay with just the platitude of, oh, it's socioeconomic status and education? It's not, it's more than that. And those issues actually run deep and they're uncomfortable conversations, especially within the medical community, because medicine has kind of, I guess, encapsulated itself away from a lot of the societal issues as though we don't operate within society. We've kind of been separated from that, so to speak, although the things that we see in society have also played out in the medical field. And I think now we're just starting to really be very honest and open about some of those issues. The impact of structural racism and systemic racism and how that disproportionately affects certain groups of individuals and then in turn leads to bad outcomes. The impact of bias, implicit bias, and sometimes in some instances overt racism, and how that also leads to decreased quality of care for people, and how it impacts and influences the relationship between clinicians, providers, and their ability to see and hear patients, and to meet them where they are in a way that really views them as a whole person, and to be able to address their concerns in a unbiased and equitable fashion. And so I appreciate the fact that we are now starting to have those conversations. They are long overdue, but I know that without those conversations taking place, we will never be able to get to the ultimate goal of true health equity and actually seeing a change in those statistics.
That's great, Dr. Owens. Maya, I'd love to hear a little bit about, Dr. Owens talked a lot about decreased quality of care, regardless of, we've always heard this term, social determinants of health, right? But this is when we're talking about Black maternal health we're talking about women along the socioeconomic life spectrum. It's not just one group. So what are some of the things that you think that we can do that are key to improve care for Black women as they're giving birth, as they go into pregnancy?
Yeah, it's a great question. And transparently, I think that it all begins with listening, right? Listening to what Black women say, listening to their concerns, fully addressing those concerns. I think it's really important to keep in mind that when we talk about the Black experience, when we talk about Black pregnancy, it is not a single experience, right? There is a huge diversity in experience based on a whole host of the factors that have already been mentioned here, right? And I think what we are challenged to do, and we think in how we think about how we can better serve Black women, is really thinking broadly and holistically about the diversity of challenges and the diversity in life experiences that we need to consider, right? And understanding that, Dr. Owens, you and I have talked about this a lot, right? When an expectant mother presents to you in your clinic, there's a whole lot that is a part of her story, right? And part of understanding what it is that she's experiencing in that moment and in her pregnancy is understanding the complexity of all of what's happening in her life outside of that, right? And so we talk so much in healthcare about whole person care and an acknowledgement of the person. And because of a lot of what Dr. Owens mentioned, bias and sometimes explicit racism in the care of Black women, it is so important and so meaningful for us to understand that experience. Ask mothers what it is they're concerned about, what it is they're worried about in their pregnancy, what it is they may be dealing and coping with outside of those walls on that day, and making sure that we are taking a broad view in how we think about care and how we think about support, right? When I take a step back and think about how some of these disparities for Black women are impacting the healthcare ecosystem at large, right? I think it's important to say that these are not decisions that impact only that mother, right? When we are not adequately serving Black expectant mothers, we are driving a breakdown in that woman's life. We are driving a breakdown in her family, in her community, and at society, in society at large, right? When we think about some of the implications on all of those breakdowns, right, across that ecosystem, and this matters to all of us, right? And so I think it's just really just very, very important to take a long-term view, right, of what better care could mean, and make sure that we are wrapping Black women and Black mothers as our most vulnerable, right, for a myriad of reasons, with adequate support, right, and doing that in a way that we can meet them, right, on their own terms, and really address broadly whatever it is they need in their life at that time, to make sure that that we can drive some of these disparities down.
Yeah,
it comes down to community-based care, right? And I know Jacqueline will take us there in the conversation, but making sure that where we lack a degree of cultural competency in our care, we have other ways of supplementing our care teams to make sure that we are approaching this life stage with trusted support and partnership. And I think that there's a lot that comes into play there.
I love that, Maya. I love when you started in saying it's about listening to Black women, right? I think so much has been written, there's been so much data around how Black women are not heard in the healthcare industry. So I want to move to this topic around advocacy, especially self-advocacy. Speaking up for ourselves is super important. I know as a first-time mom, I remember reaching out to my mom, and she was like, I don't remember. It was 37 years ago. So it was like, I needed some advice of how to speak up for myself. And I actually had a doula. And that's why I love, Jacqueline, that you're part of the conversation, because I think outside of the health piece, it was the emotional support, it was the knowing what to look for that really helped me feel very much more confident walking in to give birth. So let's talk a little bit about advocacy and what that means. Jacqueline, please, I'd love to hear your thoughts around, especially when we look at, a pregnant woman, what does advocacy mean for her? How does she find her voice? What can she do?
Yeah, so mastering self-advocacy in a pregnancy can literally change the entire trajectory of your birth experience from the beginning to the end. And like Maya was saying, there's so many interconnected pieces in our experiences, and we all come from just these very different backgrounds. That insecurity, lacking self-confidence. When these things show up in a birth experience, you're not very likely to self-advocate for yourself. And so as a doula, that is one of my most primary roles outside of supporting families emotionally and obviously physically, but I'm actually helping them learn how to self-advocate for themselves. That's being able to be firm and speak up when you are experiencing pain or when you know that something is not right in your body. The reality is that no one else walks around in our bodies every day but us. Mm-hmm. We have professionals that have metrics, but at the end of the day, we are very individual people. And so when it comes to self-advocacy in that birthing space, being able to say, this is what's going on, or I have a question about this, and being able to engage your care provider and your support team, number one, you will become more informed the more questions you ask. You'll be able to make actual informed decisions and have informed consent throughout your birth experience. You'll be able to become more courageous, as you said, like, Mom, what do I do? Like, this is crazy. And I think for so many of us, we have exercised control in so many other areas of our life. And then when pregnancy comes, every time, us three here, me, Maya, and Dr. Michelle, we have 3 children, but it's almost like a clean slate every time where you're like, oh my God, like I feel helpless again. Like I won't do this again, what's happening? And so becoming empowered and making sure you have those supports in place. Self-advocacy for Black women, though, looks like not allowing people that are caring for you to put you in boxes, social boxes, racist boxes, female boxes. If you are being labeled as angry or overreactive or the pain is not that deep, a lot of us have issues that might go undiagnosed or uncared for because we're kind of like, well, maybe I am tripping, or we get that self-doubt going in our own mind that might pull us back from being proactive in our care. Right. For me, self-advocacy means co-creating your care with your entire support team, with your OB, with your nurses, with your doula, with your mom, with your husband, with your partner, with whomever is a part of your birth experience. And when we think about self-advocacy in that way, it makes us responsible. Mm-hmm. We are responsible as well to be engaged in the process of our birth experience, of our life experiences. And so when I hear self-advocacy and I think about the many families that I've supported, it's a tool that transcends their birth experience. It's something that turns into transforming their relationships that they have with their family members and their partners and their spouses and their children, because it helps them to create boundaries. It helps them to get clear on what they really desire. And it helps them to pay attention again and be engaged in those details of their life and of their life experiences. And so my personal perspective is like, how do you go wrong with that? Like, yeah. That can never be, bad. And so amplifying self-advocacy and understanding, like, you are not subject to this experience. You are a part of this experience. You are co-creating this experience, and you are able to choose the people that are supporting you along the way, making sure you get all the information you need, that you feel respected, honored, and informed every single step of the way.
I love that.
I love what she just said. I just want to jump in real quick, because I think that is so important for women to, for birthing people everywhere to take from this. In so many areas of our lives, especially as Black women, we have to we are told to harness our energy, to dim our light, to step it down a little bit. But in your birthing experience, that is the fullness of everything about it. It is the genesis of life and everything that comes after. And your birthing experience should not be something that happens to you. It should be something that you experience and that other people experience with you. And I would even go a step forward to say that birthing people should feel empowered to be able to lead in that experience. And it's like, this is my experience and you can come along with me. Mm-hmm. And I'm saying that as a physician, but I believe that experience is really for, like, I love it when my patient can take the lead And when she can tell me what she wants to make her experience meaningful for herself and for her family, because then I know the medical part, I know the science piece, I know what to do there, but how do I make this special for you? And I can't create that. I know what it looks like for me, what I would want, but I don't know how to do that for her until she tells me. And so I'm the kind of person who likes to ask. If you have a clinician or provider who's not the asking type, then let them know, open that door, share that information. And that is the way that you create the experience that you want, because I might go from one room to the next, and then before the end of my day, I may have done 5 deliveries or experienced 5 births. But each one of those is unique and special for that individual, and I am a small part. And if somebody walks into the room and they want to run your birthing experience, then you absolutely should be able to step up and tell them pump the brakes and redirect.
Yeah, I love that, Dr. Owens. I was going to ask you, beat me to the punch, because I think people hear the word advocacy. I think you said it, Jacqueline, the 3 of us or the 4 of us had, we're very vocal, we are bold. And I always said, like, learning to be an advocate before my baby was here allowed me to be an advocate after she was here. So I'm the advocate at school, I'm the advocate on the playground. I learned and harnessed those skills from the voice that I was able to find, partially due to my experience with my doula. But Dr. Owens, I really wanted you to kind of, if you could crystallize what that looks like. We've talked a little bit about during the pregnancy, but what does that look like in the hospital? What does that look like postpartum too? Because I think those are important parts of, it's not just 10 months. You're really going through this for a while. So what support do you need, and what does self-advocacy look like? How does it show up in that way?
Well, so I think first, if you're talking about intrapartum, I would say that it starts with planning. And it doesn't mean that you have to walk in with a 50-page birthing plan, but if you have one, hey, that's fine. We'll sit down and we'll go through every page. But I think that there's an intentionality about it, right? If there's anything that's going to happen, then you want to have an intentionality about it. So think about that experience and what you envision it being. And I think that those conversations actually start before you actually end up in labor, or before you get to the point where you're showing up on labor and delivery. Now, sometimes things happen and things are a little bit accelerated, so you may not always have that opportunity. But I think it's important, and there's never a point where it's too early to start thinking about what you want your birthing experience to be, because we really don't always know when that opportunity is going to present itself. So I think first thinking about it, and then having the conversation about whatever it is that you desire or want with your provider. And the other piece is, look, we all know some people may say, well, I'm going to have a doula. I've had some of my patients will say, hey, Dr. Owens, will you FaceTime my doula in a prenatal visit? This is my doula, this is my person, so that we have a relationship that has been established prior to me meeting them in labor and delivery. Sometimes I get that benefit, other times I don't. But I think for those times when people have done that doula gets to kind of sniff me out. And I've been hazed a little bit by some doulas, and it's fine. I love it. I mean, because our focal point is on that birthing person, right? And so if that's our focal point, then, I'm like, haze me away, and I'm going to check you out and make sure you're okay too. Because we are both working for the betterment of this patient, and we're going to see how we can come together to make sure that they have the best experience possible. The other part is thinking about like pain control. If there's a change in your plan, if things don't go exactly as planned, how do you want that information communicated? And the other piece is how you best communicate, because everybody doesn't always communicate exactly the same. And so being able to think about that and think about how you want that information given to you is also very important. Those are kind of the main things that I think about intrapartum. The other thing is, I will say that one of the things that we don't always do very well, I say we, in the obstetrical environment, is that we are not always the best communicators in an emergency. And that is the time when it really that's counterintuitive, right? Like you would think that in an emergency is the time when you would want to communicate more. But I think there are times when the focus shifts, and if an emergency is recognized, the ability to communicate that effectively in a way that does not create undue alarm or stress for the patient and her family in that moment is a challenge. We're still working on that. But I think the other part is recognizing, or at least having conversations. Hey, what do I do in the event of an emergency? I would like for you to please let me know what's happening before somebody jumps on my bed, starts pressing on my belly, or before you start wheeling me out of the room. Like, just tell me what's going on. Have somebody, or this is my person, make sure that they hear what's going on so that they can then bring me up to speed. Little things like that we take for granted, I think are really important.
I agree. And I would love your perspective, Maya, on this, because what you just described, Dr. Owens, is the definition of true self-care, right? When we're talking about, it's not just about the massages, and like, it's really about self-advocacy and asking for help, because we don't need to be a martyr, right? So Maya, talk to me a little bit about ways that we can, to Dr. Owens' point, practice that pre-pregnancy, but also postpartum, because I think it's important even after the baby arrives.
Yeah, absolutely. Self-care is so critical. I mean, I think first, I just wanted to underscore the importance of something Dr. Owens just said, right? Is that this is a period of deep vulnerability for all of us, right? For those of us who go in and plan and have, such clarity in terms of what we want to experience, those things happen, right? And Dr. Owens, that experience you just described of, people rushing in the room, feeling your belly, rolling you out to the operating room for C-section. That's exactly what happened to me with my first daughter. And I think it's really important to just remember that we can do what we can for our own self-advocacy. Sometimes we need that advocate outside of ourselves also in the room, right? Because it's a deeply vulnerable period and there's so much at stake. And it's difficult to know in that moment, if you should blindly follow this guidance or if you should push. And it's such a difficult thing to balance, right? So critical, right? Moving on to this topic of self-care, I think it's just of utmost importance, right? I think what we know when we think about some of the disparities that Black women are experiencing in maternal health, there are a myriad of factors coming into play. And one of the things that we absolutely know is coming into play is weathering, right? It's this idea of how chronic stress and some of the chronic stress stemming from racism actually impacts us physiologically, right? How it changes our bodies, how it changes our risk profile. We know that we need to be attuned into that, right? And we know that it is there for all of us. And so what that means is that we have to think and be really proactive about nurturing ourselves, right? Nurturing ourselves through pregnancy, nurturing ourselves through the postpartum period, and removing ourselves from some of the stress and some of the fear that naturally is a part of the experience of Black pregnancy, right? It's naturally a part of pregnancy, full stop. For us as people of color, it is part of our experience, right? Because not only are we going through this absolutely life-changing thing, but we're going through it knowing the stats and knowing all about these risk factors and knowing about bias in our own care. And it is frankly terrifying, right? Because we know that the stress also impacts our health. It's really critical for us to take a step back from that and remind ourselves to do daily affirmations, remind ourselves. I remember my husband said this to me in pregnancy almost daily. There is a lot to worry about, but remember that the most likely outcome is a healthy baby, right? And if we aren't so lucky to have that, we'll figure out a way to manage, right? And so it's really, really important to just recalibrate and pull ourselves back and remind ourselves that this is a natural process and one that we can handle, and that there are proven strategies and tactics that can help us to handle it if it's all feeling too overwhelming, right? It is those affirmations, it's journaling, it's stopping to take deep breaths, it's centering, it's using meditation. It is just simply taking a break from thinking about the fear and the stress and taking the opportunity and committing the time to remember that it is a beautiful and natural experience and one that we as Black women can handle.
Yeah, it's beautifully said, Maya, beautifully said. I think, Jacqueline, I'd love to talk a little bit about the fourth trimester. We've hit on it a little bit, but what can we do? I mean, I think women who are going to listen or families that are going to listen to this, they want actionable steps, like little nuggets that they can remember. I think what you said, Maya, about meditation. I mean, Maya and I know each other personally. She knows I'm a meditation queen. In my office, it's a cool place to be, right? So, because it's always calm. But what I imagine people, especially women who've given birth and now they're bringing the baby home, and it's that fourth trimester that we talk about. What are some things, what advice would you give that mom?
So my advice is very consistent. Be prepared and be present throughout the entire process. And so what that will look like postpartum is during your third or second trimester, beginning to think about meal prep on a larger scale, where you're putting those gallon bags of soups and pre-made meals into the freezer, that you're stockpiling it so that you don't even have to think about it once you get home. It is making sure that you have put family on notice, that there are certain boundaries that you would like to have respected that are in effect immediately as soon as you get home from the hospital. It also looks like having those conversations about who can actually support you. Your system of support may actually shift postpartum. And so beginning to have those conversations during pregnancy, finding out where the people that you love are at in their life and who has a capacity to support you, and then planning accordingly, making sure that it's not coming by surprise. Oh my gosh, I had this baby and now we're here. Having intimate conversations with your partner, with your husband, with your parents, with your extended family, and with your children. I am a firm believer on just going back to that martyrdom syndrome. The martyr is dead, honey. Black women have been a martyr for millennia, and that time is done. It's over. And so with it being over, there comes a level of responsibility and boundary creation with that so that we can all flourish. I don't believe that being a martyr at all has served any of us. It hasn't even served the people that we've been martyrs for. And so number one, removing that as an option, removing the option of prioritizing every other person in your postpartum season. And for the first time in your life, perhaps saying, you know what, I'm going to focus on me. What will fill my cup? Because guess what? We are amazing and fabulous and dangerous when our cups are full. So there is not going to be a loss by taking care of ourselves and making sure that we have the things that we need. So that meal prep, making sure that your freezer is stocked is super practical. Making sure that you pre-order or have things on schedule that you'll need in terms of any pads, any diapers and things like that. Have that on an Instacart or Amazon delivery schedule, or you can just stock up ahead of time before your due date. Make sure that you have support systems on deck with your partner in home. Honey, I'm not cooking for 2 weeks. Children, I'm not doing any laundry. Here, let me help you. Let me show you while I'm pregnant. Let's get prepared with the increase in responsibility because I'm not going to be able to do it for this particular period of time. And again, it's whatever's comfortable for you. My personal recommendation is at least 30 days, but not everyone has that particular luxury where they can just heal and drink the teas and eat the soups for 30 days and not really move around too much. But what you can do is tailor fit those same tools to whatever your life is like. You want to make sure that you have red raspberry leaf that helps to tone your uterus. Make sure you're having a cup of that every day as you're healing. Make sure that everything that you're eating is warm as much as possible so that you're giving your body a chance to heal and get itself back together, because birth is a cold event. You're losing blood, you're birthing a placenta, you're birthing a baby. And so you really need to renourish your body with ginger, black pepper, red pepper, like all the cultural foods that we can imagine that are like yummy and spicy. You want to stock up on those spices and make sure that you're putting those foods and those nutrients back into your body. The other key piece is making sure that you're making appointments with postpartum specialists that can help you actually heal, like a pelvic floor therapist or a physical therapist. Don't push past the discomfort that you're feeling in your body or any kind of tweaks and things, even a chiropractor. Like, I love chiropractic care during pregnancy, but making sure you get a follow-up appointment just to make sure that your body's in alignment and taken care of. Because the last thing you want to do is feel like you've actually crossed the finish line by pushing the baby out. No. You're right in the middle of the marathon and you still have a little ways to go. So now, instead of your OB and your birth doula, you want to make sure, yes, I have a postpartum doula. I provide traditional services as well, where I'm closing the bones, I'm preparing food for people, I'm steaming and doing hammams and things like that. But even if you're not doing that, making sure that you're taking care of your body, being mindful, not allowing the little red flags that it was okay to ignore when you weren't pregnant. You're not ignoring any of those. And it requires such a level of presence and mindfulness that you've got to be still. You've got to have those moments of meditation, doing that breath work so that you can stay connected to your body, not just throughout the pregnancy and the birth experience, but also postpartum, because a lot of those Black maternal numbers that we're looking at around death, it's not just stopping at birthing the baby. That actually extends out into that first, 8 weeks. Those death numbers are included. So you're not off the hook just because you've given birth. You still have to be mindful, you still have to be present, and you still have to set things in place and create boundaries in place so that you can have a healthy postpartum experience.
I love that, Jacqueline. I mean, one of the things I always say is they even tell you on the airplane to put the mask on yourself before someone else. And we often forget that because we are raised as that being selfish, like take care of everyone. But if I don't have any oxygen, what good am I to anyone else? And you're basically talking as a metaphor of oxygen of life. Meditation is oxygen. Having no stress is oxygen. Making sure you have a network of people around who can support you. That's oxygen, So you need to definitely, we got one comment in the chat from Makita Williams who said, whew, well stated. She was like feeling everything you were saying. So I appreciate that. I know that we are close to time. So we have about 5 to 10 more minutes. And I definitely want to get to why we're here and why we've been brought together, which is this amazing platform called May. And as the founder and CEO of May Maya, I'd love to know what specifically, I mean, you mentioned it in your intro, but if you don't mind talking a little bit more about the specifics that you felt that you needed, but you weren't getting, and what you hope and what May is being built to provide to women.
Yeah, it's a great question, right? And I think that we all, I think I can assume and probably correctly say that we all probably felt instances of marginalization in our own pregnancy care, right? In ways large and small. What I hope May can be as a resource for other Black women moving forward is a resource for removing some of those feelings of marginalization in our pregnancy care, right? So in essence, what we're driving for and what we're really hoping for is to facilitate more meaningful investment in Black care and Black birth and in Black children and mothers, right? Or birthing people, I should say. Really important for us in achieving that is working in partnership with the folks who are paying for healthcare. Working for healthcare payers, I think, is really, really key to our strategy, because I think what happens far too often is that there are evidence-based interventions that we know work, right? They are not applied consistently. They are not too often they are not offered to Black women, and they are not leveraged at scale, right? And so one of the things that we are really hoping to solve for as a company is to bring some of these evidence-based, best-in-class models of care and support to Black women who most meaningfully need them, given the degree to which we are suffering from these maternal health disparities, right? So May, in essence, is trying to do that, right? We're leveraging a lot of these clinically based interventions, things like symptom awareness, education, real-time monitoring of our physical state, our emotional state, some of the social and structural barriers that are getting in the way of our care, and providing support with all those things as they arise over the course of the prenatal period, over the course of the postpartum period. And what we're also trying to bring to bear is some of that community-led model of support, right? So in addition to what we're doing on the digital health side within May and just being a consistent source of information and guidance for expectant mothers, is working in partnership with the community-based experts, right? Community-based doulas who are known to drive the right sorts of outcomes for Black women, right? Where we know very well that doulas can impact rates of preterm birth, right? Which often have lifelong health consequences for our children. We know that doulas are successful in driving higher rates of spontaneous vaginal births, reducing some of those C-sections that aren't required medically, all of these sorts of things. We know that these interventions work, right? And the problem is that they are not offered to Black women at scale, and they are not offered to Black women too often without out-of-pocket pay, right? What we also know is that Black Americans for far too long have had healthcare access barriers that are financially driven, right? And driven through some of those social determinants barriers, right? That we have dealt with generationally, right? And so part of what I think would be success for May as we go is getting these solutions to more Black women and more Black birthing people at scale without out-of-pocket pay, driving these clinically based interventions into the hands of those who most need them, right? And at this time, these are our Black birthing people here in the US. And so what would be success for us, I think, is nurturing some of those partnerships with healthcare payers, working in close collaboration with some of the incredible community-based experts who are supporting Black women, marrying those two things to really start to wrap our mothers with the level of care that we need and deserve.
Awesome, thank you, Maya. Dr. Owens, we have a question in the chat that I think we have to answer before we close. And I'm gonna have one more question after this for you, Maya, but I want to get this question out there because I think it's very relevant to what perhaps a lot of birthing people are feeling right now. It says, what advice do you have for a pregnant woman seeking prenatal care during COVID, when so many healthcare providers seem burnt out and sometimes callous?
Ooh, that is a great question. So what I would say is that my opinion is that in this world, in my OBGYN world, in the world of birthing experience, that compassion is essential. And that while compassion fatigue is a real thing in COVID, that compassion in the birthing experience is essential. And if you don't find that if you're not feeling that in the environment that you're in for your prenatal care, that you owe it to yourself to find a clinician with whom you feel that you have that connection, because that connection allows you to be seen and heard in a way that you will miss if you do not have a compassionate provider. And so we talked earlier about the increased adverse outcomes. And you asked Maya about what May should achieve. And one of the things that she and I have talked about that is something that's really important to me is how we can use this platform to help fill in those gaps of incomplete or subpar relationships with clinicians. And people say, well, that sounds crazy. How can a digital platform do that? And we've got really smart people who are working really hard to answer that question. But this issue for marginalized communities in general, but specifically for Black women, is not going to change. It's not going to get better until we find a way to fix that problem of the gap in relationship, the failure of that connection, whether it's related to bias or just a person not really having a level of cultural humility or whatever it is. Until we fix that, then there's still going to be people who fall through the cracks. There's still going to be people who aren't going to be seen. So if you don't have it, go somewhere else until you find it. And it is worth pounding the pavement until you find that, because once you find it, it's everything. And without it, it makes your experience so difficult. And that, I think, is paramount in the self-advocacy piece, because we do this at Walmart. If somebody's nasty to us at Walmart, we'll call the manager and we'll decide we won't go there. If somebody treats us bad at a restaurant, we decide we're not going to go there to eat, or we'll tell somebody, I'm not ever going there because they didn't treat me right, whatever. But when it comes to our healthcare, we, for whatever reason, believe that we don't have the power or the authority or the ability to say, not treat me right. Lady at the front desk was nasty. Nurse was nasty. You're nasty. I'm not coming back here anymore. We feel like we got to keep coming back. We don't. So please, 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 you owe it to yourself. That is one of the first indicators of the type of quality that you will receive, is the way that those people treat you from the moment you walk in the door.
You're getting so many snaps, virtual snaps, Dr. Owens, in the chat. People saying, this is so good. Thank you for answering my question.
Run, Forrest, run, run.
Hey, is it okay to just quickly insert to answer Brittany's question?
Sure. I was gonna get into that one, but yes, go ahead.
Yeah, so Brittany asked an amazing question in the chat about how long postpartum is. And this is one of my favorite topics, because typically we're hearing about that 6-week period, which is a super critical time in postpartum. But in general, it's up to 2 years. And I had done some research and found an article that said even up to 10 years, especially if you have not reset your hormones and taken care of yourself properly and actually recovered postpartum, your body can actually experience that unsettling and imbalance up to 10 years after you've given birth to your child. And so the other thing to understand about postpartum is that this is an event. Your organs were moved. Like you've carried DNA that's a blend of yours and someone else's. Like this is a whole thing for your body. And so that's why the intentionality postpartum is so important, because you can actually deal with the negative or positive effects of that for up to a decade after you've given birth. And so if you feel like, oh my gosh, I didn't get it right and my child is 4, you can still go see that pelvic floor therapist. You can still focus on your nutrition. You can still go get a panel run and get your hormones checked out and get that taken care of. You can still exercise and do these different things to help get your body back in balance. But by no means is it a 6-week period and then, oh, I'm out of postpartum, which is a misunderstanding that many of us have regarding the postpartum season. So that was an amazing question, Brittany, and I just wanted to put that out there for those that think you're tripping when you're like, I am not back to normal. What is happening in my life right now?
Yeah, I love that, Jacqueline. I think you said it earlier, it's listening to your body and being present. Like there's no set timeline or when you have to be done with it. I'm done with, no, you have to listen to your body, because you said every pregnancy is different, not just every person, but every pregnancy is different. Before I close out with Maya, Jacqueline, I'd love for you to just tell us a little bit about your nonprofit work that you're doing in the postpartum nutrition space. You talked about making sure you have those soups and everything, which I think people need to hear a little bit more about what you're doing in that space.
Yeah, so I run a nonprofit. It's called the Akionu Birth Foundation. And 2 of the biggest gaps I've seen in care with my birth and postpartum families is mental health and nutrition. Folks were out here struggling. And so I founded my nonprofit to provide 6 weeks of meal prep by personal chefs that are delivered to the homes of newly postpartum families, and 6 weeks of mental health support for families of color with therapists of color, because culturally relevant care is also something that I see is lacking. And so because of our unique positioning, as Black folks, as Indigenous folks, as Asian folks, we all have different things culturally that go on. And it's super important that we're getting supported with culturally relevant care in that mental health space as well. So that's what we do. That's what we provide to the community. And it's something I'm extremely passionate about. But that nutrition And honey, if I could just say, your biggest thing might be making sure you still see your therapist through your postpartum experience, just to catch anything that's happening. It could save your marriage. It could save your sanity. It could save a whole bunch of things. So those are always two things: good, warm nutrition and a good therapist in your postpartum, in addition to everything else that I spoke about. But that's what we do at Akionu Birth Foundation. Thank you for asking.
That's great, Jacqueline. I wish I had that. Do you guys deliver in New York City?
Not yet.
Dude. And then I just want to close, Maya. We talked about what your vision for May is, but I would love to know what your hopes are for the mini May mamas that we hope will soon be a part of this amazing village that you've created and that all of us here are huge advocates for. What are your hopes for the May mamas?
Yeah, look, I think that anything that we as a team can do to fundamentally reshape this experience, right? And change it from being an experience that is rooted in fear and vulnerability, right, which it has become for so many of us, to it being an experience that is rooted in joy, right? It's easy for us, right, as entrepreneurs and founders to think about the numbers, and certainly I hope that we can reach as many mothers as possible, but I think we should celebrate every one person we can support in making their birth experience more meaningful, more rooted in beauty and peace, and safer, importantly. And so, really at the core of what we're doing is, I think, reshaping that experience one Black birthing person at a time. And the more we can serve, the better and the prouder we will be.
Beautifully said, Maya. Beautifully said. Thank you guys so much. This has been Dr. Owens, Jacqueline, Maya. This has been one of the best experiences and discussions I've had, especially today. It fills my soul with joy to know that the attention is being paid to this topic, to these women, to the birthing people that sometimes, like you said, don't feel like their voice is heard. And I think we've left them with core tips, core nuggets of how they can actually move toward being advocacies for themselves, and how platforms, like you said, Dr. Owen, that intuitively may not feel like it's there to help you, but digital platforms are now bridging that gap. And so we're really excited that you could join us today. Thank you for all the questions from all of the visitors, and we look forward to seeing you the next time.
Thank you so much, Joy.
Bye.
Thank you.
Bye-bye.